5-Minute Pearls for Clinical Practice. Today's pearl is called Keep Our Tools Clean. Hello, this is Dr. Brian Morris, and this is 5-Minute Pearls for Clinical Practice, where you will learn the tools to provide exceptional care for your patients. This is the weekly podcast where you will be introduced to time-tested, evidence-based patient care strategies that aren't always taught in schools or training programs, but are nonetheless crucial for success in clinical practice. And each podcast episode is about 5 minutes. This week's pearl is called Keep Our Tools Clean. This week's pearl is a very simple but practical one. Keep your stethoscope and other medical equipment clean. As healthcare providers, we are constantly reminded to wash our hands and keep a sterile field during procedures. However, I don't often hear reminders to keep our stethoscopes, our otoscopes, our reflex hammers, etc. clean. In February of 2014, a very interesting article was published in the Mayo Clinic Proceedings where they measured the bacterial counts on stethoscopes and also on the hands of physicians immediately after seeing patients. The researchers found an alarmingly high level of virulent bacteria, sometimes resistant staph, on the stethoscopes as well as the fingers of the doctors. Interestingly, the researchers found a very strong correlation between contaminated fingers of the doctors and contaminated stethoscopes, with a particular association between the fingers on the dominant hand of the doctors and the stethoscope. So sterilizing the bell and the diaphragm of your stethoscope between patients is very, very important, as well as the tubing of the stethoscope, which is another hidden haven for bacteria. But also, please pay close attention to washing the fingertips of your dominant hand, which appears to be the main portal of entry for bacteria onto the stethoscope. We should be thoroughly washing our hands before every patient and also sanitizing our stethoscopes and other medical devices that have direct contact with patients. I also find it particularly important to wash my hands in front of the patient. It really helps patients feel more comfortable and assured that you are keeping things clean when they physically see you wash your hands. By carefully attending to these sort of recommendations, we do our best to protect our patients from unnecessary exposure to potentially harmful bacteria. Let's keep the dialogue going. Let me know what you think of this week's Pearl for Clinical Practice. Post your comments and your experiences on the 5-Minute MD Facebook page. You can follow us on Twitter at Brian Morris MD. You can visit us anytime on our website, which is 5minutemd.com. We've been working really hard on the website. It looks really quite good now, very colorful and professional looking. There's a lot of information posted there. All of the podcast episodes are posted there. And also, we are busy at work on another podcast, which will be debuting in the near future. This new podcast will focus on healthy habits and helping patients to practice and learn new healthy habits. Although it will be directed at patients and not healthcare professionals, I still think healthcare professionals might find it interesting, and it might be something you want to take a listen to in case you want to recommend it to your patients. The plan is that we will have podcasts specifically for patients as well as for healthcare professionals. If you have just a couple of minutes and want to help out and support what we're doing on these podcasts, please take a moment to stop by iTunes and leave us a review. Let your friends and your relatives and your colleagues know about what we're doing on these podcasts, and please make sure that you are subscribed on iTunes. When you subscribe to the podcasts on iTunes, you will receive new podcast episodes as soon as they are posted. Thank you so much for all the kind support. We so appreciate the kind emails and feedback that we're receiving. And of course, thank you so much for listening. And as always, I will see you at the next 5.